I'm used to getting steroid shots every 3 months. But when you educate them about the dangers of steroids, and the cartilage is destroyed by repeat steroid injections, so we're actually making the problem worse.
That's a tough pill to swallow when you like finally dig and you're like, oh my gosh, how many joint replacements have I hastened? Oh,
Yeah.
sorry, Grandma.
Our motto for our protocol is fear fades when the path is clear. So I truly believe we've been able to crystal clear paint the path for these patients. I was in a room for maybe 5 minutes. Now I'm in that room probably 3, 4, 5 times longer than that. And I don't leave until they have everything that they need.
Welcome, everybody, to Conversations in Regenerative Medicine. Please join us for this exclusive webinar series to have a conversation with pioneers in medicine and discussions about regenerative medicine as we tackle some controversial topics, uncovering cutting-edge insights that are shaping the future of interventional orthobiologics and cash-based practice. So I am very, very excited to bring Dr. Ryan Molli here to the stage today, and we will start meeting questions. Yes, we can do all of those things. So without further ado, while we are admitting everybody to the experience here, for those of you who don't know who I am, I'm Dr. Ariana DeMers. I am a board-certified, fellowship-trained sports medicine orthopedic surgeon and regenerative medicine aficionado. I also do a lot of educating and training in both ultrasound, orthobiologics, and cash-based practice. I have been successfully able to move my rural Northern California practice away from insurance, and I focus on cash-based procedures. And I am most passionate about helping doctors to incorporate orthobiologics and cash-based practice seamlessly in their practice. I am so pleased to bring to you Dr. Ryan Molli. He is the founder and CEO of Whole Health Orthopedic Institute in Meadville, Pennsylvania, founder of the Orthopreneurs Conference, board certified orthopedic surgeon, fellowship trained adult reconstructive and total joint surgery extraordinaire. He did an AO trauma fellowship in France, and he has pioneered some very, very cool things, including cash-based orthobiologics and orthopedic integration. So he's been doing this for a couple of years. So without further ado, welcome, Dr. Molli. I'm so glad that you were able to join us today.
Yeah, thank you for the invitation. Appreciate it very much.
Absolutely. I'm always happy to have, leaders, thought leaders in the field, people who are thinking outside the box of how we were traditionally trained to take care of our patients. So for the next hour, I'm really excited. So thanks everybody for joining. We are talking about cash-based practice, regenerative medicine, exploring controversial topics, and I think we will be able to bring you some actionable insights that you can implement in your practice. And of course, we will have a live Q&A session to get your burning questions answered from Dr. Ryan Molli. So I do believe that orthobiologic treatments will be first line treatments for musculoskeletal care in the next 5 years. So that is my goal. I got a lot of work ahead to make that true. But the train is leaving the station, and if you are not actively offering orthobiologics and cash-based care, you gotta get on the train. So the problem is that sometimes successful integration is hard. Many of you are looking for a successful way to integrate orthobiologics into your practice. we do know that this is a great treatment for our patients, but how to do it successfully sometimes is more elusive. Maybe you've tried some things. Maybe you're saying, gosh, I'm not sure about the science. Maybe the techniques, there's a high barrier to entry. Ultrasound training maybe wasn't part of our training. Cash-based business feels maybe daunting or overwhelming. Marketing, sales, and maybe you just thought, I'm just not good at business. But it's not our fault because we did not learn this in school. That being said, it is a learnable skill. And so if you are struggling with how to successfully integrate orthobiologics and cash-based practice into your clinic, you're not alone. But definitely, we're going to share some insights on how to capitalize on this $4 billion orthobiologics market out there, okay? So please put in the chat what you maybe are struggling with the most, and then we can address that at the end of this conversation. So the question is how do we win? And we're going to be talking a little bit about the perspective of a total joint surgeon and where we're going in the next 10, 15, 20, 25 years, and how do we provide whole person health? How do we do a better job at not siloing our patients and not focusing on, the one thing, to go really deep and, I only do left knee replacements. I only do great toe procedures. And so when we are talking about that today, we also need to consider how we talk about this with our patients. How do we talk about cash-based care when maybe our patients have different ideas about what's fair? So this is going to be what we talk about. Clearly, we need a system. And we're not going to go over all of this today, but we are going to go a little bit further down this journey and talk a little bit more about cash-based practice, about whole person health, and then we'll talk a little bit more about what that system looks like. So we are going to get into this conversation. Dr. Ryan, Molli, we have questions for you. If you can please tell me a little bit about your current practice model and maybe how you came to choose a concierge or cash pay, because I know you've kind of been in transition this little bit. So if you can share with us maybe the last 5 years, I know you've been kind of this evolution. That'd be great.
Yeah. So thank you again, Ariana, for the invitation to have this conversation. And I think this is an extremely valuable topic for many physicians out there that are maybe on that edge of dipping their toe in the water versus just going all in. So I was kind of your traditional orthopedic surgeon, insurance-based, up until about 2020. And we all know that there is, and I have a private practice. I started my own private practice, Whole Health Orthopedic Institute, on January 1st of 2018. Always kind of had this functional medicine, whole health approach where we weren't just saying, oh, you've got an arthritic knee, you need a new knee. Really wanted to help patients with weight loss, medical optimization prior to surgery, because for me, it helped me reduce complications, which meant happier patients, which meant more patients. So it was always kind of baked into the practice, but the practice itself was very traditional, very insurance-based. And in 2020, after having some conversations with one of my college roommates, he's not an orthopedic surgeon, but he's a non-operative sports med doc. He was a team physician for Virginia Tech men's basketball team and one of their soccer teams for many years, up until just literally the past couple of months. He is an MD VIP, internal medicine, non-op sports med surgeon. So he has this concierge practice that I was very intrigued with. And then after having some more conversations with some fellow orthopedic surgeons who started their own concierge practice, these conversations were happening about 2019. In 2020, I decided, I need to do something, because with private practice, our cost of, everything that we're offering and doing, whether it's our mortgage, our all of our staffing expenses, the healthcare benefits, it continues to rise. And after COVID, all of our medical supplies, it would rise. All of our malpractice insurance, it would rise. And our reimbursements continue to decline. You do not need to be a accountant, mathematician to realize that this is a recipe for failure if you don't make any changes. And how do you make the changes? How do you do it in a fair way? And how do you do it where you can stay busy? So what I decided to do in 2020 was to introduce a concierge model that was essentially an offering that if you wanted me to do your hip or knee, you could either choose a traditional pathway, which was purely insurance-based, or you could do the concierge pathway. And the concierge pathway would bring with it such benefits as earlier surgical dates. So I typically would do about 6 joint replacements per day, 3 days a week, so 18 to 20 or 21 joint replacements per week. And I just kind of figured out my schedule where the demand of this got to be to the point where it's about 25% to 30% of my practice. So I would reserve 4 slots for traditional pathway patients and 2 slots for concierge patients, and they all filled. And they would pay me a cash membership fee for 1 year for the concierge membership. And not only did it get them sooner surgery, but it gave them direct access to me through cell phone, text messages, things like that. We included multiple different DME products that were not included or covered by their insurance plans. And then just different concierge types of services. Like I did some house visits for some of these people. I would get all of these people a hotel very close to the hospital because I practice in a pretty rural area and our draw is about 3 to 4 hours. So it would cut down on, things like that so that they could not have to drive in the morning of surgery. And it worked really, really well. And I did that for about 5.5, almost 6 years. And then in July of 2025, decided to shut that program down, even though it was doing amazingly well, because I wanted to build something that was more fair, more all-inclusive, and it kind of took out what I call the paradox of choice, where people could either choose this versus this. And that's when we created the Orthopedic Journey, which we launched that protocol and concierge program on January 1st. So it is now, if you want me to do your hip or knee replacement, you could choose to not have me do it, but if you choose to have me do it, you are going to be enrolling in our The Orthopedic Journey protocol, which is a 5-step protocol. All the things I've learned over the past 16 years of practicing, what works, what doesn't. We have health coaches, so we help with medical optimization, weight loss, smoking cessation, people that are malnourished, people that are diabetic, where their diabetes is out of control, and we optimize them before. We give them a year access to a software app that I'm developing, and just this entire package. We use perioperative nutrition, and we've expanded all of the offerings of things that we give to them that are not covered by traditional insurance companies. Every patient gets a Fitbit. All of our obese patients get a Bluetooth scale. So we're literally setting them up for success for their recovery of their journey.
Amazing, amazing. So, when you kind of have this whole person health, how early they're like, okay, they come to see Dr. Molli, they need a joint replacement. How do you get, how soon do you start? Do you start right away with all of this like preoperative, perioperative optimization? And then, what have you ever had these patients where they're like, oh, now that I'm optimized, my knee doesn't really hurt that much?
Yeah, so we do. We start before they ever come in for an appointment. Brand new patients, hip or knee pain, they get labs, and we get a full panel of labs. We're looking at, nutrition markers, albumin, things like that. If they are diabetic, we're getting, all of the complete metabolic profile, as well as a hemoglobin A1C. We're checking vitamin D levels on all of these patients. So we're starting optimization literally right out of the gates and assessing these patients and really trying to set an expectation from the get-go. I mean, I joke all the time. I say we're a orthopedic company that does a lot of hips and knee replacements, but first and foremost, we're an education company that happens to put metal and plastic in people's hips and knees. And one of the biggest things that they get too is, as I was sharing with you earlier, is the 9 hours of personalized video content and education that I have recorded, which took me about a year and a half to do that. And it's literally every topic you can think of, from perioperative nutrition to the importance of tight glucose control, both before, during, and after surgery, to nicotine cessation, vitamin D optimization, things like that. So they have full access to that app, and those videos are given to them in a very, very strategically positioned order, so that they get a video every single day for 3 months around their surgery, typically 3 or 4 weeks leading up to surgery and 2 months after. And then the second part of your question was, are these people getting optimized to the point where their joints don't hurt anymore? Well, we also, January 1st, incorporated regenerative medicine. So there was a lot of changes at Whole Health on January 1st. It was kind of like a rebirth for the practice with our protocol, as well as the regenerative medicine part of the practice. And we've seen some amazing results with the regenerative medicine piece, where I'm thinking, me 5 years ago, these people absolutely need a joint replacement. And my conversations changed with them. And I really started to have deeper, more meaningful, longer conversations with them to see what they've tried, what their goals are. And after, kind of a personal experience with some regenerative medicine myself, I saw the powers of it. And I was like, the body, and again, just my functional medicine, like brain, it's like the body's innate ability to heal is probably one of the most amazing things, that is on planet Earth, right? Like, we as orthopedic surgeons, we think, yeah, we healed that broken bone. No, we may have put a plate on it or put a rod down through the bone to put it in position, but the body healed the bone, right? And the same thing, before antibiotics were discovered, people didn't die from every single infection that they got. They rarely died, and the body had an immune system that was able to fight off the infection. And so when we start thinking about orthobiologics and the power of orthobiologics, and how we can create a regenerative process that doesn't always require metal and plastic as the end result, I mean, I think it's an amazing thing to offer to patients, and it's the right thing to offer to patients.
Awesome. That's fantastic. So, do patients really want surgery, or they just want that function, that mobility, the longevity? Is that what they're looking for when they come to see you?
Yeah, I don't think that anyone really wants surgery, and if they do, maybe they've got a couple crazy screws loose up in their brain. They want the
Kind of
results.
bummer. Like, that's the solution I came to as well. I was like, dang, none of my patients actually want what I'm offering.
Yeah,
They
they
don't
want
actually want surgery.
they want the end result that surgery can bring them, which is kind of a restored life, which is our last step of the orthopedic journey, which is they want to be able to go to the ball games for their grandkids. They want to be able to go out and get the mail. They want to be able to play tennis with their buddies, or go shopping with their girlfriends. So they want that quality of life back. And yes, hip and knee replacement surgery, that's what I do, has done an amazing job of being able to provide that. But it also is a major operation, has inherent risks, and complications that can be absolutely devastating, most particularly infection. So if there's a way that we can either delay it, prevent it, or optimize it, right? Like, I don't think that we're ever going to be getting away from joint replacements or surgery. I don't believe that, but I do believe that regenerative medicine and orthobiologics are going to really, really augment and enhance, even if we do surgery, the biologic recovery that is available and possible. Whereas before it was just like, well, we'll put the metal and plastic in and let the body the time will heal it. But I think we can augment.
Awesome. Well, I still have more questions. So, do you think, when you look back, what are you so glad that you're able to offer now with your orthopedic journey protocol and maybe regenerative medicine options, whole body health, whole person health, that has been the biggest limitation of insurance-driven care?
Yeah, I think before it was, just get on the treadmill, the hamster wheel, run away, increase your volume, and that was the only way that it mathematically was going to work out, right? And a lot of employed physicians, they know that model very, very well. Being private practice, I do have the luxury of controlling my own schedule, how many patients I see, how long I spend with every patient. And I will tell you that I spend a significant amount of time with them compared to what I used to spend with them, 5 or 6 years ago. I was in a room for maybe 5 minutes. Now I'm in that room probably 3, 4, 5 times longer than that. And I don't leave until they have everything that they need. They have the answers that they need. They have the time, um, and just that energy needs to be brought to them. And I feel like this transition has allowed me to practice much better medicine, right? Like the type of medicine that I want my mom or my dad to receive. And when I created the orthopedic journey, like the whole idea was about, all right, if mom or dad ever need a hip or knee replacement, how do I want my mom or my dad to experience that care? And I don't want it to be cold. I don't want it to be impersonal. I don't want it to be rushed. I don't want it to be fearful, because I think surgery is easily one of the most scary things that these patients are, experiencing. And, our motto for our protocol is fear fades when the path is clear. So I truly believe we've been able to crystal clear paint the path for these patients through these 5 steps of what it looks like. And with the video education, which we've had unbelievable feedback. I mean, the patients love getting a video from me every day, even though I spend a lot more time with them face to face in the clinic. Now they get to see me every day. And those videos are short, they're to the point. They're one topic per video. They're maybe, on average, I'd say about 5 minutes long. Some are a little bit longer, some are a little bit shorter. But they really appreciate those touch points. They really appreciate the fact that they can reach out to me. Every single patient now has direct access to me through the app. They can message me through our HIPAA secure chat option within the app. They can access my team as well through the app. We can give them important reminders about upcoming appointments, instructions before surgery, so that we don't have someone eating, the morning of surgery. We don't have someone not taking their perioperative nutritional supplement the correct way before surgery. We got away from all opioids. This is like the most new development. About 3 weeks ago, we started using Journavx on 100% of our hip and knee patients, and none of our patients, I think, other than 1 or 2 that just blatantly refused it, have received any opioids or narcotics, and we're having tremendous success with that too. So I just think that it's allowed me to go back to the roots of practicing really good old-fashioned medicine, of taking time with patients, giving them all the options, right? Before it used to be, here's a steroid shot. We'll do that every 3 months until you're ready for surgery. Now, I have signs in my rooms that say, I don't want to inject you with steroids anymore. And we will do it if it's a special occasion, right? You have a wedding, you have a trip coming up. But other than that, my best options for you are an orthobiologic option, whether it's PRP, PRP with MFAT, or, bone marrow aspirate, versus, are you ready for surgery? And the adoption, I thought, was going to be very resistant. Like, hey, I'm used to getting steroid shots every 3 months. But when you educate them about the dangers of steroids and the multiple studies out there that have shown that, the cartilage is destroyed by repeat steroid injections, so we're actually making the problem worse.
I know that's a tough pill to swallow when you finally dig in. You're like, oh my gosh, how many joint replacements have I hastened? Oh,
Yeah,
sorry, Grandma.
exactly.
Well, this is so fascinating to me, and I really do. This is why I invited you on, because you are now embodying a new way to practice orthopedics. So, what do you think that successful joint replacement practice looks like in 2035?
Yeah, I think it's going to be whole health and whole body oriented. I think that for so long, we have focused on the day of surgery, that 45-minute procedure, on average, right? Most joint surgeons that do a lot, they're 45 minutes, maybe an hour, maybe 30 minutes. But why do patients and why do physicians and providers spend so much time focused on this? And yes, I do believe that I'm a huge muscle sparing advocate for both hip and knee replacement surgery. I design implants for implant companies, so I think how we get to the joint matters. I think how we put the implants in matters. I'm a huge kinematic alignment guy. And I think what we put in matters tremendously. But at the end of the day, I think the preparation phase and the guided recovery phase are way more impactful. And you can screw up a really good operation if you don't prepare well or you don't guide them after surgery well. So I think what patients are really looking for, and ultimately what physicians are going to be looking to provide, is literally the entire gamut of care, from first moment that we meet them to, offering all options, whether it's regenerative medicine, whether it's more traditional conservative care, versus joint preserving procedures versus joint replacement procedures. But when we get to that surgical phase and we're talking about a joint replacement, it's not going to be focused on, hey, do you use a robot or do you use this? It's going to be focused on, what's your perioperative nutrition look like, your protocol? What are you doing after surgery, right? Are you doing the old no pain, no gain postoperative therapy protocol, or are you doing more of, our protocol is very similar to Andrew Wickline's less swelling, less pain, where for the past 10 years, my patients, for the first 3 weeks after hip or knee, they lay flat on their back 80% of the time with their feet above their heart, and we control swelling. And by controlling swelling, we reduce pain, we improve motion, we reduce complications such as blood clots and things like that, because we're using gravity, and the patients are much happier. So I think it's the whole spectrum. It's not just the day of surgery anymore.
That's amazing. Well, clearly I have more questions for you. This has been definitely a mind-expanding conversation, and so encouraging that we are moving the needle on how we think about an episode of care, how we think about our patient as an actual person from start to finish, how they experience our profession. And, I agree, as I've gone along this journey into orthobiologics and regenerative medicine, I can tell you hands down, I am a much better doctor than I was 10 years ago. I come home, I'm like, man, I did some good doctoring today, like real live doctoring, right? So it's been fascinating. So how do you see orthobiologics fitting into that continuum of care between that conservative care and that surgery? Like, what's your kind of thought process or algorithm when somebody comes into your practice?
Yeah, so I think the previous was, are you ready for surgery or not? Right? And the patients would always ask me that. They're like, what do you think, doc? Do I need a knee? Do I need a hip? And I would always tell them, is like, I don't know. You'll tell me when you're ready for it. I said, there's 3 things to me that make up a really good physician. I said, number 1, we have to use these, what God gave us on the sides of our head. We have to be able to be good listeners. So I spent a lot of time listening to my patients and reading surveys, questionnaires that they filled out to see what's bothering them. And really, one of my biggest questions is, what's their number 1 goal? What do they want to be able to do that they can't do now? And then once I understand that, then it's like, all right, well, what's the next step of being a good doctor? I think we have to use these things. And you and I are both osteopaths, so we've been trained with our hands. I've seen so many surgeons go into a room and they don't even lay their hands on a patient. They don't examine them. So for me, I'm assessing, swelling. I'm assessing ligamentous stability or instability. I'm assessing crepitus. I'm assessing range of motion restrictions, tightness, tissue quality. Are they really edematous in their ankles? I'm using my eyes to examine them too. And then the third thing is, what they all focus on are my x-rays. What are my x-rays showing me? And I say, it doesn't matter what they show. I can tell you what they show, but the x-ray isn't a quality of life. It can be a severely arthritic knee or hip, but if you're still living a pretty meaningful life and it's not creating more bad days than good days, then I wouldn't do a joint replacement. And if you're struggling in the simple things like maybe some Motrin or Advil, which is not totally benign, by the way, right? I mean, we have people with declining kidney function, people with hypertension, and metabolic disease that are coming in here. So it's really becoming that physician again. And I would agree with you, Ariana. Like, I feel like I'm a much better physician now than I was 10 years ago or even 5 years ago, because I was becoming very much a technician, right? Here's the problem, here's the solution. The joint is arthritic, I'll replace it. And now I feel I'm more, I tell my patients I'm a physician first and foremost, and I'm a surgeon secondarily. That doesn't mean that I do any less surgery or that I enjoy doing surgery any less, but there is this middle ground. And that's where regenerative medicine, I think, really, really has this amazing ability to augment patients' care and physicians' practices, right? The fact that it is a cash pay. Some people may see that as an obstacle. Other people see that as a solution, right? And I think as long as you educate and you tell people, hey, listen, this isn't covered by insurance, but these are the benefits of it. And you see people spending tens of thousands of dollars on certain procedures and they're not getting much relief. And then other people offering things at a much more reasonable rate and getting great results. So I think it's a great opportunity for, again, patients and providers together.
So hello guys, I had to be on my phone. So we were talking earlier about rural California. And the one thing about rural California is that we have an unstable power grid. And we now have no power. And so my internet's out in first world countries. So here we are on choice 2.
Well, that was a quick fix.
Well, here I am. So, yeah, we are, and we have all our friends here. So I'm so glad. So we were talking about how, where do you see it? And you think, you don't offer cortisone unless it's an emergency, and you're offering regenerative medicine as this bridge. What % of your patients are saying yes to regenerative medicine first?
So, again, January, we had a lot of changes at the practice. We started the protocol. We also started the regenerative medicine. So I went from not seeing any new patients myself. I have 5 PAs in my practice. They saw all the new patients and they would do all the conservative care until they needed surgery. Then they'd send them to me. When the protocol got rolled out, I felt like I needed to be in control of the conversation and the discussion. So I saw 100% of all new patients. And it was a very different role for me. And I was the front and center talking about what we're gonna do next. Here's the options. Here's what I recommend. So I was the one that was kind of selling and educating on the regenerative medicine piece. As time went, and it was about early April, so we gave it about 3 months. We realized that we needed to make some transitions. It's like you think this is going to be better, but then you do it and you're realizing like maybe there's a hybrid. So we actually went back to the old way where the PAs started seeing all the new patients. Unfortunately, the regenerative medicine enrollment definitely went down. I think they're just not used to or comfortable having those conversations as much as I was, even though, and it's like old dog, new trick, right? Like they were so just used to steroid, or visco supplementation, but without any use of this. So I sent 2 of them to a regenerative medicine course to get them educated on it, and they've adopted it better, but it's still not as high as I would like it to be. So I know I kind of answered your question a bit, but we're still like in the infancy, right? We just started month 6 of the year. So we're figuring it out as we go, but the implementation, patients are now coming and asking for it because we are marketing it a bit. You know, it's on our website now. We have a regenerative medicine tab. We have regenerative medicine brochures that we've created that are in every exam office. I have a kind of a warning sign talking about steroid injections, especially leading up to joint replacement. And I have a TV in every single room, and we constantly are just educating on what we do, how we're changing, but always trying to get better.
So imagine it's 2035 and you are looking back on the decisions orthopedic surgeons made in 2026. What are, through that lens, what do you think they got right? And maybe what did they still miss?
I think that there is this push, this transition of regenerative medicine. I think there's a push for the entire episode of care, the perioperative optimization piece. I think it's a small percentage of traditional orthopedic surgeons that are getting it and embracing it, and the ones that are, they're like, yeah, this is the way. So I think that number will grow as it just gains traction. So I think that in 10 years will be a much bigger piece of individuals' practices. I think where we're still getting things wrong is we're focusing a lot on technology, and I'm guilty of this. You and I had a conversation earlier about how I'm creating an app. I do think that technology can be really, really helpful and beneficial to help educate patients and help us with precision and things like that. But I feel like there's just so much focus on whether it's robotic surgery, whether it's the latest, greatest widget to make a surgery. Again, I think there's just still too much emphasis on the actual surgery. And we're not spending enough time or energy on the deeper, more meaningful conversations of before and after, right? I think the bubble's going to burst too in terms of traditional healthcare, and I think it needs to in terms of the insurance plans, because to think that every surgeon's going to get reimbursed the same amount, yet our outcomes are very different. I mean, there's a bell curve in life. There's really, really, really talented, very good surgeons. There's some that probably shouldn't be doing surgery, and then there's the people in the middle. And I think that's their technique aspect, but also how they approach medicine and education and this and that, and perioperative optimization and postoperative recovery protocols. So I think as we focus more time and energy into the entire patient experience, patient outcomes are going to increase. And I think that the bubble's going to burst in terms of insurance, and some different type, I don't know what it will be, whether it's not going to be all cash pay for sure, but I think there will be different compensation models based upon results, which I think that's how it should be, right? Like professional sports, every single player doesn't make the same amount of money because there's some that are really, really good, and then there's some that are role players, and then there's some that are bench players. And the same thing is in medicine. So I think the most talented, the most committed, the most dedicated, the ones that are working the hardest, the ones that are moving the needle the most, should be rewarded the most.
Yeah, absolutely. So what would you tell, an orthopedic surgeon that is on the fence and they're like, gosh, I really want to add it, but I'm nervous, I'm scared. People like, how do you talk about it? How do you talk about the money piece? Like, what do you think is way more simple than we think it is? First.
Yeah. I mean, honestly, I remember my conversation with you when you were on my podcast several years ago, because I wasn't doing this at that point. I had a concierge branch of my practice, but the regenerative medicine piece seemed scary, right? Because people were so used to steroid injections or just things being covered by insurance. So my first toe in the water was the concierge piece, and it was an option, right? It wasn't mandatory. And so I felt like that was an easy way to kind of break into it, was to say, hey, And I had a major problem. My wait time was excessively long. So it was either I do this and give some people the opportunity to move up sooner in the wait time, or I'm going to start losing patients because they don't want to wait that long. So it was like, I'm damned if I do, damned if I don't. And I chose to what I felt was the lesser of two evils, but also something that would help me from a private practice standpoint, which was improve the reimbursements, right? And improve the experience. And my happiest patients were my concierge patients. They had more time with me, more face time. They had direct access to me. So when I started seeing that, I was like, these people really like this. There were some disgruntled people. I'm not going to lie and say that everybody bought into it, because they didn't. Again, you and I talked about that before. I think there's just some delusional people out there that think everything in life should be free. And that's just not the reality. And people pay for convenience. People pay for quality. People pay for this or that. So I just kind of came to that realization that and also I wanted to really enjoy the work that I was doing and felt valued in the work that I'm doing, and not taken advantage of by a system that I don't have any control over. And, you know, I'm a private practice too. So I don't like being told what to do by administrators that have never been in the trenches. So I've always kind of been that like entrepreneurial guy. So I just said, you know what, I'll have these difficult conversations. And as you have them, they get easier. They get much, much easier. And it honestly only took me a couple weeks to kind of find my rhythm and my groove. And I would say, rehearse it, right? Just like anything, rehearse it. Have a conversation with your wife, your husband. Have a conversation with your practice manager. Have a conversation with a previous patient that you have already operated on. And I would say one of the errors that I did initially with everybody was I went into the healthcare saga, right? Like the oh, poor me. I wasn't trying to be oh, poor me, but I was saying what the reality is of declining reimbursement, increasing costs of running a private practice. And quite frankly, people don't care, right? Some people do, but few and far between, and they just don't care. So I'd say save your time and energy. Don't even go down that path. If people start giving you pushback and saying, oh, this isn't right, you're charging this, or you're only accept, then I think you can go into the business, because now they're actually talking about the business. So it's opening the door of that conversation.
Absolutely. You know, I'm more than happy to be transparent about what their insurance company is actually reimbursing me. And they're always up in arms. They're like, well, what should we do? I'm like, well, call your representative. I mean, this is a contract between you and your company. If you don't like what the company is reimbursing, you should probably tell them. So that's really good. I think one last piece of advice, and then we'll go to some Q&A, is like, what do you think the next best step? If someone's like, shoot, man, if Ryan Molli can do it, I can do it too. What do you think that next step is? What should they do tomorrow and be like, okay, I think I can do this. I'm going to do X.
Yeah, I think it's just like having the confidence and believing in yourself, right? So I tell people all the time, I'm not a Vegas fan. I'll go there for the shows and the food, but I don't gamble, and I have no problem with people gambling. The only thing I have ever gambled on in my life is me. And I feel like I can control that, right? I can't control a craps table. I can't control a poker table. I can't. So for me, I know that I'm going to show up. I'm going to do the work. I would do your research. And if you're in a private practice setting, it's just like, well, you either control your destiny or your destiny is going to control you. And you either make these changes. And I would say like probably the safest way is to do maybe some type of hybrid model before you go all in. And, you know, that's kind of what I did when I started the concierge branch of my practices. I still accept insurance, right? So your cash pay concierge doesn't pay me to do your surgery. It has nothing to do with that. It's all the additional things that it covers. And with our current protocol, we have a concierge membership agreement. You have to have a really good healthcare attorney to make sure that everything is on the up and up. And quite frankly, my protocol, you and I were talking earlier offline, Ariana, I charge them half of what I used to charge them, and they get 10 times more than what they used to get. So I'm probably charging way too little, but I think it's a really good start point. I would not outprice yourself, but don't underprice your value either. You need to know what you're worth. And I think just do your research. If it's going to be regenerative medicine, do some local, regional research to see what other practices are charging for PRP or whatever the level of care is that you're looking to kind of match, and be competitive with it. I don't think I would be super cheap on it, because then they're going to create questions as like, well, is that just not as good or whatnot? Like, be competitive.
Or blue ocean, and it's class of one.
Yeah.
And then you don't have to worry. I think a lot, I do think, and I will speak out against this, is I think a lot of physicians underprice themselves, don't know their worth, and charge way less than they should for these services. We've done a lot of work looking at regenerative medicine and pricing in a private practice model. And when we look at it, all things told, the cost of goods is not the only cost that goes into it. And so that's usually what is calculated. And people go, well, the kit costs this, so I'm going to do 2 times kit or 3 times kit. But the overall costs are significantly higher. And so we've done across the board calculations for all of my physicians who I coach, and it's come up with the same number for every single private practice physician. Break-even rate is $2,100 for PRP. So I'm just gonna, I don't know what you charge, but you take that to the bank and make sure that you're charging what you're worth, that you're not undercharging. And we don't want this to be a race to the bottom. We are not Walmart. This is high acuity, personalized medicine, and you've put a ton of thought and care into the journey, into the patient's experience, into the outcomes. You are so keyed in to those outcomes. Of course, you should be, reimbursed accordingly to all of that hard work and expertise and knowledge and courage to be able to provide this service that's very different than the status quo.
100%.
Awesome. Well, I think we're going to go to Q&A, and we'll go from there. So if anyone has any questions, I think here we are. You can just raise your hand. There's no open questions. I'm clearly doing this on my phone, which is really impressive. We have maybe one chat, everyone. If we don't have any questions, I'm going to keep asking him questions because I'm fascinated. So tell me this, when your PAs are seeing your patients, oh good, we'll get that. When your PAs are seeing your patients, what do you think is the biggest hurdle for them to kind of wrap their mind around? What makes it different for them to talk about regenerative medicine versus you?
I think it's just the fact that, again, the old dog new tricks. Like, one of my PAs has been a PA for close to 40 years now, and it's maybe part of I've been doing this my entire career, and these patients seem to do well, and they come back every 3 months because the steroid shot works, and they're repeat customers, versus like this new option, which really kind of maybe in their head is thinking like, have I been mismanaging these patients for close to 40 years, right? And that could be like a harsh reality, right? Where you're just like, oh, right? I mean, we used to use wood for hip and knee implants too, and that didn't work out so well. So
we've done all sorts of things that were maybe a bit questionable.
Exactly, right?
So that's what science is for, right? So that we can continue to keep up with the pace of what's happening.
Yeah, I think the other piece too is like just the lack of ownership, right? So when I'm having a conversation, I know what's going on behind the scenes and what the practice looks like from a financial standpoint. Again, that my employees, yeah, they care about the health of the practice, but they don't care about the health of the practice. And they think that they care, but at the end of the day, it's what's best for me, right? What's going to be easiest for me? What's the path of least resistance that I can keep doing the same things that I'm doing and just stay on the steady eddy of making the same. And I've incentivized them. I've said for each patient that you sign up for, whether it's PRP or a PRP with NFAT or bone, like you get X percent of the fee. So it's like, and that's a million times more than what you were getting for a steroid injection, right? So it's what's good for the goose is good for the gander. I feel like rewarding them, and it still hasn't produced the results that I thought it would. Because I was like, oh, they'll be ecstatic with this. And it's just like, you want to raise every year. You come to me, you want more bonus. Well, here's an opportunity. But it's just that deeper conversation that they have to have. And maybe they're just resistant to having that conversation or spending more time. I don't know.
Yeah,
Maybe you
yeah.
can answer that for me. I don't know.
I do think it's partly education. I think I think you're going to actually, what you're going to see is they're going to get wins for the patients that they converted. And they're like, Mrs. Jones is doing so good. And then they're going to be on board. Because then they're going to be like, I want more of this. Because that's what our experience, right? Is like, oh my gosh, this is so good. How can we not offer this, right? The outcomes are phenomenal. So I think maybe just time and more experience with the new quote new stuff is going to give them the confidence
Yeah.
to be able to talk about it more clearly. So there's some questions. What is your best marketing tip for Regen, and like how important is social media, Sir Social Media King?
Yeah, so I haven't done a ton of marketing for regenerative medicine on social media yet. Like I said, we updated our whole website this year just because we have so many changes with the protocol. We added regenerative medicine on there. Um, we have a marketing guy that goes out in the community. We're doing an event here in a couple weeks where we're offering it to other providers, but also to lay people, the patients, where we're going to talk to them about our practice, all the services that we provide, including regenerative medicine. I do think that there is a place for it in the social media world. I think you, Ariana, probably could answer that better than I can, just because you've been doing it a lot longer than me. But we haven't tapped into that yet.
Yeah, absolutely. I think it depends on when you're talking about regenerative medicine. I think education, and you're doing the education, and so that translation is the same. Whether you're educating about why they can't have a steroid shot, why they have to do perioperative care before their procedure, it's the same thing. Anytime you want something to change, you have to have so much education that goes into that about what it is, why it's a better choice, why you're the better choice for them, to just continue to build authority and build trust for your patients. There's two questions. How did you get around being in network with insurance and offering cash concierge services at the same time?
Yeah, so again, it's not one or the other. It's all about how you set it up and how you set your agreements up with your concierge patients. So again, we're not charging patients additional money to do their surgery. Their insurance company pays for their surgery. Their insurance company pays for the global period. Their insurance company pays for certain DME equipment, which is not a whole lot, right? They're not going to pay for ambulatory SCDs. They're not going to pay for any type of cryo cuffs or polar care type of units. They'll pay for a walker. They'll pay for a cane, that kind of stuff. They'll pay for a range of motion brace if you need that. So you can build it. And this is where, again, having a really good healthcare attorney can help you build your concierge agreement so that there's no crossover, there's no questionable double billing or double dipping whatsoever. And that's where that hybrid dipping your toe into the water, I think, is it's the route that I chose to take. And maybe it will lead me more towards a pure cash-based practice down the road. But I think where I live too, I would be abandoning a lot of patients just because I'm in a very, very rural area, a lot of blue collar workers, and there's just a lot of people that wouldn't be able to pay, like, X amount of thousands of dollars for a cash pay procedure. They may be able to pay the professional fee, but are you going to be able to pay the facility fee, right? And that's now you can still be out of network with the professional side of things, but in network with the facility. So there are ways to do that, and we looked into that as well. But it can get a little confusing to patients at times when they're getting their EOBs and things like that. So we just chose the hybrid model for now, and we'll see where things go.
Yeah, absolutely. Oops, whoopsie. The trials and tribulations of doing it on your phone. So entertaining. So ultimately, there is one more question. There was a question like, how are you coaching your front desk to get labs first when patients want to be seen because their knee is hurting? Like, and I have this question too, like, how are you obtaining labs or x-rays or something that's outside, because especially if you've never met this person? Like, how are you going about doing that?
Yeah, so it's just part of our protocol, right? So we're saying, hey, this is why we're doing it. So it's education, right? So we're having that conversation, and my director of so I have a wellness institute in my practice too. So I think that's an important distinction. A lot of practices don't have that. So when patients call, they're talking to the front desk. They're not necessarily doing this. We have somebody in the Wellness Institute that schedules all new patients. They will talk to them and say, you need to fill out this questionnaire. You need to fill out this piece of paperwork. And one of the other prerequisites is Dr. Molli wants to do a full evaluation. He wants to see the entire picture, right? I get it that your hip or knee hurts, but if your hip or knee hurts and you come in and you decide, yeah, you need a hip or knee replacement, and then a week later we get your labs and we find out your A1C is 9.8 and you're nowhere near getting a hip or knee replacement, you're going to be really, really discouraged. So we want to set the expectation from day one. So I need to have the full picture of what things look like before I can really sit down and meet with you to have those realistic conversations, right? Because if something's way out of whack, like your albumin's, 2.9, you're not getting surgery by me anytime in the near future until we can get that up. And I don't want to disappoint you. I'd rather have the conversation with you face to face and educate you on why this is important. And if you choose to go somewhere else and they just ignore it and do it, that's fine. But I honestly have not seen hardly any. I don't remember one patient that had a hard time getting labs before the initial appointment. It's all about setting expectations very clearly. And I've created videos about this too. So when you go on our website, I've explained it. So they're not hearing it for the first time. Maybe they go to our website, they say, oh, this place is all about functional medicine, all about whole health. And it's just part of their criteria. It's part of their protocol.
Gotcha. There's a question about stopping alcohol or cannabis or adding supplements prior to the regenerative procedures or even surgery for that matter.
I'll let you touch on the regenerative procedures because I don't have a big stance on that. I do have them stop all non-steroidals, well in advance. I don't have them stop cannabis. I don't have them. I don't think that they should be drinking excessively before it anyways. But in terms of the surgical stuff, we are getting a complete social history of them. I do not operate on anybody that is actively using nicotine, and I make them stop 4 to 6 weeks prior to surgery. And I tell them I want them to be nicotine free for 6 weeks after. And we do monitor, we do check those patients before with a cotinine level. And if it's elevated, we cancel their surgery and reschedule it.
And I think that's not wrong. For my regenerative patients, I optimize ahead of time, 4 weeks ahead of time. I ask them to no alcohol, no tobacco, cannabis. I would prefer that they not partake with the cannabis if they're undergoing cartilage-based treatments, because we know that has been detrimental. And they continue supplementation after their procedure as well. Vitamin D, berberine, all of these supplements, that are helpful for cell chemotaxis, as well as cellular health and wellness, and really making sure that your blood sugar is stable. They're on a regenerative medicine protocol for me from a diet and exercise. We do in-body scanning. We do all of those things ahead of time to make sure that they're fully optimized before they undergo regenerative therapies with us. But it just makes sense, you are wanting the body to be as well optimized to heal as humanly possible. And we know alcohol is a direct cellular toxin. So I think it just makes sense.
Mm-hmm.
We'll wrap this up. This final question: do you get the labs from Quest? Do you get labs from your hospital? What labs do you get? I think you went over that you get an albumin, CMP, hemoglobin A1C, vitamin D. Is there anything else that is on your standard protocol?
CBC with diff. I
Yeah.
want to make sure that they're not anemic or anything like that going into surgery. Those are the standard labs that we get. We draw all of them in our office as well because we have the Wellness Institute. We have EKG machines. And 100% of all of our pre-surgical medical optimization, and I hate the word clearance, but I'm going to use it. Clearances get done by my PA at our Wellness Institute. We do not use any primary carers, internal medicine doctors. I went away from that over 10 years ago. It just created too much confusion. There was too many Friday nights, hey, can I get the H&P and clearance from your office? And it wouldn't get faxed over in time. And then there were surgery cancellations for Monday. So I brought it all in-house with the Wellness Institute so that they just know that is part of the protocol.
Very nice. Very nice. Well, thank you so much. We are over time, to be expected. You're amazing, and you've really been thoughtful about how you take care of your patients. So I really want to thank you again. This has been phenomenal, and I will look forward to our continued conversations and looking forward to hearing more about your successes with regenerative medicine in a total joint practice. It's so awesome. Congratulations.
Yeah. Thank you, and thanks again for having me on. I appreciate it.
All right. Everyone else, thank you so much. Take care. We'll see you in 2 weeks for the next conversations in regenerative medicine. And we look forward to taking the continued questions about how do we do this and succeed for our patients and for ourselves. So have a great night, guys. We'll talk to you soon.